Well, summer is underway, and with that comes the heat. Right now, parts of New Hampshire are under a heat advisory, with some places reaching 90 degrees.
And we want to go outside, right? We've had so much rain in the past several weeks, so when it's nice, we want to be outside. But in this sort of heat, you really need to be mindful of how to stay healthy. Joining us now, Dr. Laura Paulin with Dartmouth Hitchcock Medical Center. Hi, doctor. It's nice to see you. Thank you for being here with us today.
Thank you for having me.
So let's talk about this heat. It's not just the heat in these high temperatures. Now we're mixing in humidity for the past couple of days. It'll last through tomorrow. That makes conditions even worse. So what are you saying when you talk to your patients about staying healthy and making sure that you're okay when outside in all of this?
Yeah, I think one of the most important things is to pay attention to local weather reports and forecasts so people are aware what might be happening for the day and what's forecasted in days ahead. We certainly recommend that people stay well hydrated during these times of high heat and humidity. We also recommend that people avoid very strenuous exercise during these times. And if people do need to go out, to time their outings in the early morning or evening when there might be less heat and sunlight out. Certainly, if people have existing medical conditions, especially heart and lung conditions, we recommend that they're extra careful, given that these are more susceptible to the health effects of heat and humidity. And we recommend that people take their regularly prescribed medications. Certainly, if people need help, they should seek out local cooling shelters in their area. And we also recommend that people try to stay indoors and use air conditioning and HEPA filters if possible, and try to limit the amount of indoor exposures that they may have when they are staying indoors.
And doctor, we're also dealing with wildfire smoke coming out of Canada. Does that make this heat and humidity even worse?
Yes, definitely. There have been several studies that show that there's an interaction between heat and humidity exposure and pollution exposure. We also tend to see that wildfires are more frequent during times of very high temperatures. And we also know that there is higher amount of ozone pollution also in high temperature days and high sunlight days. And of course, from the wildfires, the pollutant we're mostly concerned about is particulate matter. And unfortunately, we know that in times of high heat and humidity, the health effects of these air pollutants are amplified, meaning that there are more adverse outcomes on higher temperature days when exposed to the same amount of air pollution. And that can result in higher cardiac events, respiratory illnesses, ER visits, hospitalizations, and deaths.
Such a good point you make. So if you have asthma or COPD or anything related to a respiratory issue, you are really feeling it out right now. So what are some of the warning signs that you would recommend? What do we need to watch out for? That you either need to cool off right away, you need to get inside right away, or you have to get to your doctor?
That's a great question. So certainly this can be a range of symptoms, ranging from mild to extreme. And certainly one of the things that we ask our patients to look out for is increase in shortness of breath, exacerbations of their normal, regular baseline symptoms if they have existing lung disease or heart disease, increased tiredness, fatigue, excessive sweating, thirst, headaches, fainting, and ranging all the way up to unconsciousness and confusion. And those are obviously signs where we would need someone to get to the hospital right away. But certainly on the more mild side of things, we recommend that people continue to take their regular medications, take a break from outdoors, go indoors, and be in a cool environment as able.
Dr. Laura Paulin, thank you so much.
Thank you for having me.
Thank you.